Good morning. My name is Yolanda Armstrong, and welcome to the Friendly Inn Settlement. I am the president and CEO, and it is with much pleasure to introduce you all to the Friendly Inn Settlement. Our mission and vision is to improve the quality of life for individuals, families, and communities here in the central area. I want to take this opportunity to thank Black Cares and the women of the Links chapter of the Western Reserve for taking the opportunity to come here and to celebrate the Black History Month as we have a conversation that focuses on kidney disease. Again, welcome to the Friendly Inn Settlement, and now I'd like to introduce you to Deborah Green. Thank you.
Good morning. I'm Deborah Green, and I'm a member of the Western Reserve chapter of the Links Incorporated. And the Links Incorporated is an international nonprofit corporation established in 1946. It's one of the nation's oldest and largest volunteer service organizations. And what we do is we focus on impacting communities of color, which is why we're so happy to be here at the Friendly Inn Settlement this morning. So, February is Heart Health Month, but February is also Black History Month. So today is going to encompass all of that. It's the importance of heart health, but it's also the importance of knowing our Black history. So we have a wonderful morning planned for you. We're going to start off with one of my Link sisters, Jennifer Going Smith, who's going to lead you in some Black history trivia and activities. Again, thank you for being here. After that, we're going to introduce our speaker, Dr. Jackson Wright. Thank you.
How's everybody doing? Yeah, can you stand up for me? We're going to get busy. Stand up. We got to do some celebration. Yep. Celebrate. We have a lot to celebrate. We have a lot to celebrate in terms of our history, in terms of who we are, our proud people. So I want us to celebrate just a little bit. I want us to really celebrate this announcement we had yesterday. Does anybody recognize this woman? Celebrate that announcement. Sue Brown Jackson, she was nominated by President Biden to be the next Supreme Court Justice. That confirmation we are hopeful for, we are positive will occur in April. So let's celebrate our history that occurred yesterday. Thank you for partying with me. I'm going to lead us in some games. Why don't you guys have a seat? We got lots of prizes, so put your thinking cap on. Put your hands up and dare for me, all right? So I got a couple of questions, and we got a table full of prizes. I hope I win, because there's some good-looking prizes back there, and we'll see how well we know some of our history. Some of it's old, some of it's new. We'll learn some new things along the way. All right, if I could have the next slide, please. So the question is, which of the following was invented by an African American? A, the hair dryer, B, the mega water gun, C, the stopwatch, D, the light bulb, or E, the curling iron? I see this woman right here in the front. B? D as in dog, the light bulb? No. Go ahead. Nope, right here in the front. B, the mega water gun. Bring this woman a prize. Who's got our prizes out? If you could stand up and we'll bring you a prize. Thank you. Yes, the mega water gun. We'll talk a little bit more about that. We use those things in the summer all the time. Lewis Holmes invented that. Let's go to the next click, please. So, who was the first African-American woman to become a self-made millionaire? Self-made millionaire. I heard you say it right on the top. C.J. Walker, C.J. Madam Walker. Do you know what she did? What was her product? Hair care. If you could stand up. So this next one is a little bit of history. I had to look this one up myself. I got my DJ working over there. Who is Sarah Boone? She is an African-American woman who invented the miniskirt, invented the ironing board or enhanced that patent, was the first African-American woman to run for president, or was she the first African-American woman in space? Right here in front in the blue shirt. The ironing board. Sarah Boone, that ironing board that we use was invented and enhanced that patent by an African-American woman. So the next time you iron, think about it. Thank you. All right, we got 2 more questions. Who is the subject of Stevie Wonder's Happy Birthday song? C. Martin Luther King Jr. That's right, we sing that all the time. Happy birthday to ya. Happy birthday. That's right. He created that song back, I don't know the exact year, but when we were trying to get Martin Luther King Jr. Day as a holiday, that song was first written by Stevie Wonder. Congratulations on that prize. Looks like there's some good things in there. All right, I think we've got one more click there. So you can see the answers to our questions. All right, next page, number 5. Taraji B. Henson played Katherine G. Johnson in the movie Hidden Figures. What was Johnson known for? She started the bus boycott. Her calculations helped NASA space program to send astronauts to the moon. Her desires were featured in numerous technology patents, or she was recognized as a fashion model. I saw you standing up. B, that's right, sending people to the moon. All right, thank you. All right, our last question before I turn it over to Dr. Wright here. And we're going to hold the answers on this, but the question says, what are ways to prevent chronic kidney failure? That's what Dr. Wright's going to educate us about, but what are your thoughts? Who can give me 3 ways to prevent? Somebody in the back, sir. Eating healthy? What else? Exercise? Is that one of them? No, can you give me another one? I'm going to take 2, give this gentleman a prize. Go ahead and flip the screen if you could, and hopefully I got at least most of them right, but you'll educate us for sure. But making sure your food choices are right? Your weight, physical activity, sleep, don't smoke, making sure you're eliminating your alcohol intake. Explore stress-reducing activities like yoga, meditation, and manage diabetes, high blood pressure, and heart disease. All right, thank you. I'll be back at the end. One thing, maybe. But all right, thank you.
Well, you guys are pretty smart. Who knew about the ironing board? Wow, I did not know that. It's good. Well, now I'm happy to be here to introduce our speaker for the hour, and it's Dr. Jackson T. Wright, Jr., who is Emeritus Professor of Medicine and Emeritus Director of the William T. Dawes Medical Clinical Research Unit at University Hospitals and the Clinical Hypertension Program in the Division of Nephrology and Hypertension. He received both his MD and his PhD in pharmacology from the University of Pittsburgh and internal medicine residency at the University of Michigan. He has over 300 publications and has served on many national and international advisory panels. Dr. Wright has had a major or leadership role in nearly all of the major clinical outcome trials on hypertension, cardiovascular disease, and kidney disease, conducted in Black populations over the last 2.5 decades, and was an author of the 4 latest U.S. national hypertension guidelines. He is married to one of our Link sisters, Molly L. Wright, who is a retired social worker, and they have one daughter, Adina. So please, let's welcome Dr. Jackson Wright.
Good morning. Oh, okay. It is certainly a pleasure to be here to address this group. It's a beautiful facility. It's very nice. I was actually ordered to be here by my Link wife, but this represents one of the functions that I certainly enjoy very much doing. One of the issues that we have within our community is that we don't live as long as other folk, and we can and should, and so that what I hope to do now is to give you some ideas in terms of how do you prevent and how do you prevent kidney disease, and how do you in fact live longer. Okay. One of the major causes of kidney disease, the second leading cause, in fact, until about 10 years ago, it was the leading cause of kidney failure in black patients was hypertension. Today, it is diabetes. So need to treat both in order to prevent being on dialysis. How many people in this room have family members who have been on dialysis? And I'll raise my hand also. Yeah. And it's now I'll ask, how many in this room have high blood pressure? Okay. And how many have their last blood pressure at less than 130 over 80? Okay. Yeah. Unfortunately, that's the pattern that we in fact see. There's been a change in the high blood pressure guidelines, and I want to focus on that and also focus on the reason for that change. It used to be that blood pressure was controlled if it was less than 140 over 90. That's no longer true. And in fact, I'll show you why. So, and I think this was apt in 1966, just as apt today. There is the inequality in health care, and certainly in diseases that take most of us away, is the greatest of all of the inequities. I'm going to talk a lot about hypertension, and the reason is that this is what hypertension does. It causes heart enlargement. It goes on to heart failure. It causes heart attacks. It causes strokes. It causes dementia. Alzheimer's disease that we see is actually one of the leading causes is high blood pressure. And the only treatment that we know now to prevent dementia and Alzheimer's is, in fact, good blood pressure control. And I'll show you the data. Chronic kidney disease, I'll show you the data on that. It is also one of the major causes of peripheral vascular disease, which goes on to amputation, and it also causes eye disease. When we talk about hypertension within our community, first of all, it's the leading cause of death in our community. And compared to non-blacks, the mortality is 30% higher in blacks compared to non-blacks, and 20%. It causes 30% of the mortality in black males. It causes 20% of the mortality in black females. Non-fatal strokes are about 30% higher in blacks than in non-blacks. It's 80% higher in blacks. When we talk about fatal strokes, are 80% more likely to occur in blacks compared to non-blacks. Heart disease occurs about 50% more often in blacks compared to non-blacks. And when we develop heart disease, we get it earlier. So we're more likely to die from heart disease at a younger age than non-blacks. And then we talk about kidney failure. Okay? Overall, about 4 times more likely to occur in those that look like us compared to others. And if we have high blood pressure, in fact, a black patient who's between the ages of 20 and 45 is 20 times more likely to have to go on dialysis than a white person in that same age group. So this is, as I said, it's the second leading cause of kidney failure in black patients. Now, there's also now we call it a myth, and that is that hypertension, this pretty brown skin that we have, is one of the causes of hypertension. I'll show you these data. This was done. This is a study done about 15 years ago, and as you can see, in U.S. whites compared to U.S. blacks, blacks have a higher rate of hypertension than do whites in this country. Okay. But this is U.S. blacks. Here's Finland. There's not many blacks in Finland. Okay. Here's Nigeria. There's not many whites in Nigeria. So it's not this pretty brown skin that we have that causes high blood pressure. Now, I have to say that, I usually look at my watch, say it is 11:24, and say that as of 11:24 on February 26th, we still do not know the cause of hypertension. But the one thing that we do know is that even though it is more severe in us, it's not because we are, in fact, have pretty brown skin. So that's something to keep in mind. So it also means that we can expect that we can, in fact, treat it, control it, and prevent its complications. Now we'll start with what is blood pressure. It is when the heart beats, it pumps blood through the arteries. And it's that pressure against the artery walls that is what we call blood pressure. 120, this is usually divided into two, systolic and diastolic. Top number systolic, bottom number diastolic. The systolic blood pressure, the top number, is when the heart beats. Okay, when the heart beats, it presses, increases pressure against the walls of the arteries, and that it becomes systolic blood pressure. Diastolic blood pressure is when just before the next beat. So while the heart is resting, blood pressure decreases. That's diastolic blood pressure. Both of those determine whether or not we're going to have one of the complications of hypertension. As I said, normal blood pressure is a blood pressure less than 120 for the top number, less than 80 for the bottom number. Blood pressure is termed elevated if it's between 130 and between 120 and 130. So that if your blood pressure is in that range, your blood pressure is elevated. It's not normal. Okay, and if it's above 130 for the top number, or above 80 for the bottom number, okay, you have high blood pressure. Okay, this was. 2017, 5 years ago, this was high blood pressure. Okay. Now, this is high blood pressure. So if your blood pressure is greater than 130 for the top number, greater than 80 for the bottom number, okay, and you're not on medications yet, you have high blood pressure. If you're on medications and your blood pressure is not below that, your blood pressure is not controlled. The reason for the redefining of that blood pressure was a study done in 9,000 patients, 9,300 patients at 102 centers around this country that enrolled patients. And patients were treated. It looked to see how effective is that 140 over, how valid is that 140 over 90 marker for high blood pressure, okay? And the way it was done, patients were randomized, those 9,000 patients were randomized to either treating to less than 140 over 90, which at that time was a recommended blood pressure treatment level in patients with high blood pressure, versus the lower goal of treating to less than 120 over, essentially 120 over 80. We focus on the top number, the systolic blood pressure, because patients who are over age, if you're over age 50, then you can ignore the bottom number. That number, that's no longer determines your risk of developing a complication from high blood pressure. That no longer determines your risk of heart attack, strokes, heart failure, et cetera. It's that top number. Because as you increase in age, both numbers go up, but about age 50, that bottom number flattens off, and that actually starts to decrease. However, that top number continues to increase. And as that increases, so does your risk of developing a complication of the disease. So this study was published in the New England Journal of Medicine in 2015 with follow-up data that was just finished off this year. In the study, as I said, 9,300 patients across the country. Importantly, 30% of the patients in the study were black. Okay? About 11% were Hispanic. Okay? And we had patients in the study with kidney disease, and also about almost 30% of the patients were over age 75. There was a concern that you can't be too aggressive in patients, in older patients. Okay? That's not true. Okay. The results of the trial is compared to those patients who were treated to less than 140, the old recommended treatment level for high blood pressure. Those treated to less than 120 had a 27% lower risk of developing the cardiovascular complications, including stroke, heart attack, heart failure, and cardiovascular death. Okay? Even more importantly, that patients treated at 120 had a 25% lower risk of dying from anything. Okay, so you know, whether it's high blood pressure or what, if your blood pressure was treated to less than 120, you had a 25% lower risk of dying, period. Okay? So aggressive treatment of high blood pressure prevents all of that. And the risks we're seeing in black patients also. And those data are extremely convincing, that because of the fact that we had significant numbers of black patients who participated in that study, we were able to show that, in fact, blacks benefited from that lower blood pressure just as well as did non-blacks. Results were even more convincing in patients over age 75. So as we age, and I went above that age a couple years ago, so that we too, I mean, we are even more likely to respond to that lower blood pressure compared to non-blacks. And there was a trend towards a lower risk of developing, about a 15% lesser risk of developing dementia. And that was a study that was based upon the results in from that SPRINT study. But when those findings were added to all the other high blood pressure studies that had been done, it even reached, it was significant. It was definitively shown to be that treating high blood pressure does prevent the development of dementia, so-called Alzheimer's type dementia. So on that basis, this used to be the target for high blood pressure, 140 over 90. It is now 130 over 80. Now, what does that mean? Okay. This is a survey of patients who are controlled or patients who either have high blood pressure or are being treated for high blood pressure. And it used to be that 32% of patients overall were in that range. With the new blood pressure guidelines, which were published about 4 years ago, it's 46%. So it went from 32% who were uncontrolled to 46%. Even more importantly, if you look at blacks, it used to be that between 42 and 46% of blacks had high blood pressure or were being treated for high blood pressure. Now we're talking about close to 60% of blacks whose blood pressure is greater than 130 over 80. So talking about almost 60% of blacks do not have their blood pressure controlled. Next slide. The other thing that was shown, we talk about how severe or how hard it is to control blood pressure in black patients. Okay, and even in previous studies, it showed that suggested that blacks in those studies had higher blood pressures and could not be controlled. Actually, in the 30% of patients in this study, the SPRINT trial, in fact, black patients were just as likely to be controlled, even to less than 120. Okay, as well as the same as non-Hispanic whites and Hispanic patients. There is no reason, race can no longer be an excuse for us to have blood pressures out of control. It can be controlled, okay? And that's something to keep in mind. So that when you go to your physicians and your blood pressure is elevated, then it's up to us to insist that our providers make note of that and show us how to get it down lower. Okay. Controlling hypertension, this will apply to hypertension. It will apply to diabetes. It will apply to cardiovascular disease in general. Okay. I mean, this is the way in which we manage it. One, regular exercise, okay, and talking about eating a proper diet, and I'll tell you the diet that you should use. Obviously, there should not be a salt shaker anywhere around in the house. If it's not in the house, okay, if it's not in the house, you can't put it in your food. And even more importantly, you need to read the labels on the foods that you buy. Okay. Now, some people say that food doesn't taste right if I don't have salt on it. Many of the people that I would see, you say, okay, if food doesn't taste as good, then you're less likely to eat as much, okay, which is a good thing. Okay. Okay. Unfortunately, that's not true. Unfortunately, what actually happens is that the taste for salt is acquired. The studies that we've done studies, a number of studies, comparing patients on different salt diets. And what we would do, we would randomize patients to either a low-salt diet, and in some of these diets, we actually had to give patients distilled water because they couldn't even use the water coming out of the faucets, okay, versus diets that were what they usually eat. Okay, and place them on those diets for a week or two. Patients would complain when on that low-salt diet initially. Okay. But then after those 2 weeks on that low-salt diet, when we switched them over to their usual diet, suddenly that usual salt diet tasted just as bad. So after about 2 weeks, you begin to lose your taste for salt. And so that, and unfortunately, then the food begins to taste the same, and you still have to restrict the calories. But it's not because of the lack of the poor taste. We can ask, sure. Excuse me? It has salt. It's salt. Last name is salt. Anything with the last name of salt is salt. Okay. Okay. Eating a proper diet, limit salt use, obviously stop smoking, limit alcohol use, and take medication as prescribed. Okay. And if you're taking it as prescribed and your blood pressure is not controlled, you get with your doctor and say, hey, you got to do something, okay? Because it should be. Then we talk about exercise, and that's something that we clearly need to do, but walking the dog is actually a pretty good exercise, but that's not the way you do it, okay? That's just not the way you do it, okay? And 150 minutes of regular exercise, even walking a week, is what we need to strive for. Okay, get the Fitbit, get the if you need to use the app, use that. But the key is about 30 minutes every day of exercise devoted directly to exercise. Certainly, the inactivity also causes you to gain weight, increases your risk of diabetes as well as high blood pressure, as well as heart disease. So that's something that you clearly need to manage. Has anyone heard of the DASH diet? The DASH diet. Have all of you heard? Okay. This is a diet. It's actually a pattern of diet, and it emphasizes fruits, vegetables, low-fat dairy products, whole grains, nuts, poultry, fish. It's reduced in fats, red meats. Okay, I mean those are, and obviously sweets and sugar. It's the foods that we know we should be eating, as well as avoiding the foods that we know we should not be eating. Okay, and it's. I thought I had a. Sorry, let's see if I can go back. Okay, yeah. But it's high in fruits and vegetables. I thought I had a picture of it. Of the diet, but it's fruits and vegetables mostly, and poultry, fish, low in fat. So fried foods, I mean, no need to. I mean, bake them, roast them. Do not fry. Cereals and grains, yeah. So I mean, that's what we should be eating. Now, if you just do that, then in fact. This is what happens. That alone will be as effective as any one medication that you're taking for high blood pressure. Okay? I mean, this shows the reduction in blood pressure that you see just by being on that diet. In African Americans, in fact, we benefit more than do non-blacks. Okay? It is more effective in lowering our blood pressure than in others. Yeah.
I agree that anything that comes off a tree or out of the ground is good for us, short of pesticides or genetic splicing. Okay, but if it's not organic, they will still take a chance, right? On the foods that's being treated with pesticides, they still take a chance, right?
Yeah. Ideally, I mean, certainly, if you consume pesticides, then that's not supposed to happen. Okay, I mean, but you have to assume that I hear that. I hear patients saying that if you use fruits and vegetables, then you're at risk of pesticides. Never hear people talk about the risk of things that go into fried chicken. That go into a lot of the other foods that we consume. Okay, so that all things being equal, you're better off eating the fruits and vegetables that are available. Ideally, and if you're having concern about pesticides, then simply wash it before you cook it. Yeah. So okay. the Dash Food diet, I mean, it's nothing extraordinary in there. I mean, it's, you know, fruits, vegetables, you see cereals, low-salt bread, ginger ale. You don't see any alcohol in there? You know, yeah, okay. Okay. Salt box. Yeah. Again, salt shouldn't. You know, here you have. This is what happens to salt. We are more likely to have, if we reduce our salt, then we're more likely to have that reduce our blood pressure than whites, in fact. So, and if you combine the two, as I said, I mean that's more benefit than you see with any one medication that is being prescribed. And that doesn't mean that you stop your medications. You decide to go on that and stop your medications. You go on that, and then if as your blood pressure decreases, you have your doctor taper your medications, but don't you simply replace it. Okay. Another phrase, money worth thing that if life worth thing money could buy, corollary, what comes next. The rich would live, the rich would die. I usually show this. This is a map of Cleveland, and I show it usually to my colleagues at Case because there's Huff. Huff is less than a mile away from Cleveland Clinic, UH, Case Western Reserve University. Mortality, as you can see, that's in red. So that's the highest risk of death. This looks at mortality rates in those communities. Huff is about 9 miles, Lyndhurst 9 miles away. It's all in green. So that proximity to an academic medical center or medical centers, world class, it's not doing what it should do, and that is controlling blood pressure within the communities adjacent to them. And that's something that you also need to complain about profusely. Okay. This slide is actually out of order. I wanted to show this because this looks like the daily intake of fruits and vegetables by race, and so that and change over time. And what you can see here, black African Americans here compared to whites, we clearly consume less fruits and vegetables than do whites. Makes us vulnerable to, in fact, high blood pressure, diabetes, high cholesterol, and all the risk factors for kidney disease, cardiovascular disease, and dementia. The last slide is this. If you have high blood pressure, then you should be measuring your blood pressure at home. The insurance plans now, including Medicaid now, will pay for you to have a blood pressure cuff at home. Okay, and you should be measuring it. And in fact, the data now show that blood pressure is measured at home if it's done correctly. Okay, and to be honest, I think we'll probably do a better job teaching our patients to measure their blood pressure than our staff. I mean, so that you know, I'd probably rely more on one, you're able to do it more often. Two is the fact that if you do it, we teach you to do it right once, then with simple refreshers, we're teaching you, whereas staff turnover, and so that has to be constant training. But you are probably you produce probably the most valid blood pressures, and if they're done correctly. And the way that they're done, you need to be seated in a chair for 5 minutes before you take it. You avoid smoking before you take your blood pressure. Avoid smoking, period. But certainly before you take your blood pressure, use of caffeinated beverages. The chair should be straight back. Your feet need to be flat on the floor. Support your arm at heart level on the table. And then place the cuff, an appropriate size cuff, which your provider should be able to tell you whether you're using the appropriate size. You do that twice in the morning, twice in the evening, for 3 to 5 days, and then bring that information in to your provider. These machines have memory, so that all you have to do is take the machine in, and they can read off those. And we're teaching the providers to use those as the markers to control your blood pressure. Yes?
If I may, my stepfather, he followed those rules religiously.
Mm-hmm.
And yet he died of pancreatic cancer because anytime you turn around, his papa feet.
Yeah, well, it's likely not the pills that are causing the pancreatic cancers. It's probably, that's not what's causing it. Now, if you're being treated for high blood pressure, treating high blood pressure is not going to prevent cancer. Okay, what you eat, if you're eating the diet to prevent to lower blood pressure, actually that DASH diet has been shown to prevent cancer. Okay, there are a lot of causes of cancer that we know about, and so, but it was likely not the medications that he was taking for his high blood pressure or his other cardiovascular risks, because they've been tracked and followed for just that. So, yeah.
Yeah, I just assumed that he was taking it so regularly that I
Mm-hmm.
assumed that it had been lining out of his stomach.
Yeah.
So,
Yeah.
anyway, that was just.
Yeah. No, and it's a good question. I mean, you need to question everything, and so that certainly a question that needed to be asked, and I hope I provided some reassurance, both to you that it was not the responsible for his cancer, and to others who may have had the same question. So, okay, I think that's it. Oh, keys. Healthy lifestyle, essentially regular exercise, proper diet, limit salt use, stop smoking, limit alcohol use, take medications as prescribed, and insist on having your blood pressure controlled to less than 140 over 80. Didn't talk much about kidney disease specifically, but one of the major causes of kidney disease is high blood pressure, and so that you can dramatically reduce the risk of high blood pressure. The risk of kidney disease with treating high blood pressure, and even in patients who have diabetes, treating high blood pressure will reduce the risk of developing kidney disease even more so. So, okay. Why don't we end there, and I'm happy to answer any questions that you might have.
Any questions? I can bring a mic to you.
What if your blood pressure goes low? Is that a bad thing for your blood pressure be too low?
Blood pressure of 0 is not very healthy. But if your blood pressure, ideally, when we, in the SPRINT trial, when we tried to control patients to that, to less than 120, generally we would back off if it was down, less than 105. Okay, but essentially, if your blood pressure is low, and you can stand up, you don't feel tired, you don't have any symptoms, then the lower your blood pressure, the longer you live. And sometimes I get amazed at people will say, okay, my blood pressure, patient's blood pressure, or my blood pressure is only 10 millimeters of mercury higher than what it should be. So that's fine, okay? But if you take it down 5 millimeters of mercury lower than what it should be, then suddenly, there's concern. You can forget about that concern at that level. Now, obviously, if it's you're having symptoms of it with it being low, and it's measured as being low, some patients will say, when I get it down to around 130 or so, I feel symptoms. I don't feel good. Okay. If your blood pressure is high, okay, and you take it down to normal, your body's not used to it being normal. Okay, but it will adjust. Okay, and you'll live longer. Okay, so you will feel different. When you lower your blood pressure. But that's not a bad thing. It means that you're getting to the place where you can, long term, you'll do a lot better. Okay?
Any other questions?
Oh, thank you. After having gone to the doctor here recently, I found out that my cholesterol had gone up. A1C, is that correct?
Uh-huh.
Those things had gone up. So in doing some community work that I'm doing, I've been reading that oftentimes the first thing that happens is that they give you the medication. So my question is, how long should, okay, so I'm going to do the modifications, increase the exercise, all of that. How long should I see myself trying to change that naturally? Before, I know I'm going to need to wait and see those numbers come down. But how long do I try that natural change on my own? And then if I don't see that change, when should I then say, okay, I'm going to have to do the medication?
Yeah. According to the guidelines, and I was an author on the guidelines. Everyone deserves a trial of about 3 months, 3 to 6 months. Okay, of lifestyle alone, depending upon where you're starting from. Now, if you're starting at 160 and you do lifestyle, it's not going to lower your blood pressure 30 points down to less than 130. Okay, so that and then what we generally recommend is, in fact, that you treat with medication. And then because, if you're trying to lose weight, as your weight comes down, and then as your blood pressure comes down, then we taper the medication, okay? We'll say that in patients whose blood pressure has been well controlled for a year or two, then I would generally, when I was practicing, I would generally taper the medication and see if it comes up periodically. If it did, in most cases, you will still need the medication. Okay? But there are a few who can, in fact, come entirely off medication if there's. When you start doing the things that you knew that you should have been doing all along. Okay? Even more importantly is the fact that, and especially for women, I keep saying that with kids at home, okay, it's unlikely that doing lifestyle is going to allow you to come off medication. But the one thing we can do is that if we change your diet, then we're going to change the household's diet, okay? And so that there's a good chance we can prevent our kids from developing hypertension. The fact that they don't develop the desire for salt that we did means that they're less likely to have their blood pressure rise and necessarily be treated. So if you don't want to do it for yourself, then clearly do it for those in the household who are still vulnerable but not yet hypertensive. Okay.
What are the risks related to not eating any meat?
Oh, the risks related to not eating any meat. Minimal. you know, don't forget that there are people who, vegans, live a life on without meat. So that a vegetable protein is just as good, has the same quality as red meat or meat in general. So, yeah.
Any other questions? Well, we want to thank Dr. Wright. You have a question over here? Okay. Well, we thank you, Dr. Wright, for being here. This has been very informative.
My pleasure.
And now we're going to welcome Jennifer back up. Thank you.
Thank you. You guys learned some things? I thought that was excellent. I learned a lot. Thank you. So we are going to see just how much you did learn. We've got a table full of prizes yet to give away. So the first question, and want to raise your hand, what was the ingredient that Dr. Wright said you needed to get out of your house? Salt. Salt. Who was the first that said that over there? Way over there. Who hasn't gotten a prize yet? Who hasn't gotten a prize yet? Stand up in the red shirt. Thank you. All right. What was the one thing that Dr. Wright said we really want to make sure we control? Our blood pressure. Did you get a prize yet? All right, stand up. We have a prize here. Right here in the front. Do you remember the target number? Because he said a couple of times the target number is way back in the back? 130 over 80, over there at the table over there. Excellent, you guys are paying attention. All right, he named a couple of things, and we're going to see how well we can do in terms of that. I think it was the hypertension screen that he had. And I got 1, 2, 3, 4, 5, 6 things. 6 things that he named. So who can name, at least give me 3. Yes, right here at this table, right here. Woohoo! Excellent. All right, one more question. How much time per week did he say we should get some exercise and some activity in? 30 minutes a day, or young lady, go ahead, you right there, you had another comment. Or 150 minutes a week. Get her a prize as well, right there. Excellent, excellent. All right, I think we all are going to be a lot healthier when we walk out of here. Hopefully. All right. Well, let's get back to our Black History questions. So, let's see. It says number 7. We're on number 7, all right? So, Billie Holiday, played by Andra Day. I don't know if you guys saw that movie earlier this year or last year. Also known as Lady Day, was one of the greatest jazz musicians of the 20th century. She is best known for the song God Bless the Child, and also Strange Fruit. What was the strange fruit that she was singing about? Yeah, there we are, right here. This lady right here. Give her a prize if you can stand up. It was the lynchings, right? The lynchings of African Americans. And that's why she got a lot. They wanted to quiet her down. They didn't want her to sing about that, right? What was happening? You guys are pretty good. All right. You gave me this little toy here. Woo, it worked. All right. Who is Alexander Miles? Was he the first African-American president of the United States? I hope you guys know that one. He invented the elevator door. He was the first African-American NFL quarterback to win the Super Bowl. Or he invented the gas mask. See? Nope. Nope. Nope.
Yeah, before we continue with our game, we're going to say goodbye to our audience that's watching us. So let's say goodbye, audience. Thank you for joining us.
Goodbye, audience.
I'm sorry. Let's do that again. We're going to say goodbye to our online audience. Thank you for joining us. Goodbye, audience. Thank you.
All right, so way over there. If you haven't gotten a prize yet, I'd like to see there first. But then if we can't, we're going to give you a double. You had a red shirt?